A U.S. nurse who caught Ebola while treating a Liberian patient who died of the disease has received a plasma transfusion donated by a doctor who beat the virus. 26-year-old Nina Pham was among about 70 staff members at a Dallas hospital who cared for Thomas Eric Duncan, according to medical records.
We wish this individual had not been infected, and we're concerned that there could be other infections in the coming days.
Pham has not been able to point to any specific breach in protocol that led to her infection. Meanwhile, in Germany, a United Nations medical worker who was infected with Ebola in Liberia has died. The 56-year-old man, who has not been identified, tested positive for the virus on October 6th, prompting Liberia's UN peacekeeping mission to place 41 staff members under observation.
I am, of course, sorry for him. The man was young, and he got infected because he wanted to help those affected people over there.
Human testing of an experimental Canadian-made Ebola vaccine began on Monday, with federal officials saying the drug could be shipped to West Africa within months if it proves successful.
The phase 1 clinical trials that we are announcing today will be important in assessing whether the vaccine is safe for use in humans pre-exposure. It will also help determine the appropriate dosage or how much of the vaccine is needed to give people immunity.
Ebola has killed more than 4,000 people, nearly all of them in the West African countries of Liberia, Sierra Leone, and Guinea. And a World Health Organization official is warning that there could be thousands of new cases per week unless the response to the crisis is stepped up. Matthew Burgoyne, Associated Press.